David Dow thought he was just having back problems, and that his legs were hurting as a result. But as it turns out, that pain may have saved his life.
I started working out with a personal trainer to try and work at the back issue and get my legs back in order. And kind of over probably a period of 2-3 months, discovered that it wasn't really the back, that it was more of an issue with vascular problems.
Peripheral arterial disease is, for most people, really a disease that affects the vessels in the lower extremities, causes an obstruction. The cause of it is arteriosclerosis, which is a buildup of cholesterol and scar tissue inside an artery. It's almost like a scab on the inside of the artery. Frequently, it's an unstable scab, and when that happens, you get blood clot on top of it. If one has PAD, there are two issues. What happens to your leg, and then what happens to your life?
Oh, I think for sure it's a wake-up call. The old saying, where there's smoke, there's fire. I'm sure that I not only have the vascular issues in my lower extremities, but I'm sure I have them in other parts of my body.
The real issue relates to the fact that this is sort of a benchmark or a hallmark of disease that's all over. I mean, peripheral arterial disease and this atherosclerosis and cholesterol that builds up causing it, this is like having gray hair. You don't get it on one side of your head. So if you've got it in your leg, you're going to have it other places. Nearly a quarter of patients who have claudication will end up dying by the end of 5 years. And the majority of those cases really are related to cardiac problems. If patients have severe claudication to the point where they have difficulty walking even short distances and their disease is more advanced, a little over half of them will die by 5 years. So this is a marker of a life-threatening disease.
Catching it finally at my age and quitting smoking and trying to do something about it will maybe prevent having this thing continue on, throughout the rest of my body.